In a country where the politicians tell us that they want to make life better, there seems to be a terrible stink of death about the place. And that's because of Nigeria's broken healthcare system, rated by the World Health Organization as one of the worst in the world, following decades of corruption and neglect. And then there's the education sector, also in tatters. So, as the presidential candidates promise to transform Nigeria, how much will they support healthcare and education in a country that desperately needs to strengthen both areas if it hopes to develop, modernize, and grow its economy? Well, the APC party has formed a healthcare transformation coalition aimed at repositioning Nigeria's healthcare sector and prioritizing things like primary healthcare facilities.
No matter how strong and how large the hospitals are in the cities, if half of your population are not even able to see a nurse, we have a big problem. And apart from universal health coverage, we should offer a basic minimum package of health services to citizens, even in remote and rural areas, so that they do not suffer financial hardship. The other commitment is to continuously commit to improving the quality of care at all levels, from primary to tertiary and to specialized hospitals.
Well, to assess the state of both healthcare and education in Nigeria and what the presidential candidate of the APC, Bola Ahmed Tinubu, is aiming to do about these crucial sectors if he wins, I'm joined now in the studio by Senator Dr. Olanrewaju Tejuoso, who was the chairman of the Senate Committee on Health and is currently the Pro-Chancellor of the University of Lagos and is also, of course, a leading member of the ruling APC party. Thank you very much indeed for joining us.
Thank you for inviting me.
So first of all, just lay out for us briefly the stark reality of Nigeria's broken healthcare system as you've seen it, as both a medical doctor yourself and as a senator who chaired the Senate Committee on Health. What are some of the health statistics that give you cause for concern?
Well, first of all, let me lay it on the table that the healthcare facility and capacity of the country for the middle class and upper class is perfect.
Well, perfect might be an exaggeration, mightn't it?
Well, it's just a matter of choice, really.
When you say perfect, you mean the private sector?
The private sector.
Those who can afford it.
Those who can afford it.
Yeah, but the middle class is virtually eroded in Nigeria, so that might be a bit of an exaggeration.
I wouldn't say it's an exaggeration, because whenever there's a very crucial health challenge for someone in the middle class, the money comes out to pay for it. And the facility to be used is available for them to go to.
Nevertheless,
yes.
Assuming that point is, and that's a disputed point, but assuming we kind of ride with it, the vast majority of the people in this country fall into the poorer classes.
Yes, that's what I'm coming to.
Yeah.
So I've talked about the middle and upper class. Now, the lower cadre of the society is where the challenge is. Even the World Health Organization, when they're going to talk about Nigeria's health situation, they talk about the statistics of the lower cadre. When they say we have poor health statistics, it's because of the lower cadre.
Well, you have 133 million people living in poverty.
Yes.
You have a significant percentage of people living just above the poverty line, but possibly below that middle class and upper class level that you're talking about.
Yes. So that is where the major problem is.
Yeah.
The service, the health service to this majority of the population is what is not proper today. Because we are supposed to make sure that our primary health sector is first of all the best before we talk about the secondary or the tertiary. Because when someone in the lower cadre needs health attention, the first point of call is the primary health centers. Now, in Nigeria today, we have about 30,000 primary health infrastructures, not centers, because we have been building health centers. Today, even some of the health centers are occupied by poultry, piggery, because you can't be building a kind of health institution like that, and you won't carry along the Ministry of Health. Because the Ministry of Health must confirm that they have the capacity to give the personnel necessary for that infrastructure.
So out of those 30,000, how many are functional?
Well,
as health
as of the
centers?
time I left the Senate, maybe about 10%. So we're talking about maybe 3,000 of 30,000.
Out of 30,000.
Okay, which
That's
is not
fairly
enough.
Grim.
Yes, it's not enough for a population of 200 million and counting. So really what we need to introduce now is the primary health centers to focus on them, and also at the same time we address the issue of the brain drain. If we can allocate one primary health center to any outgoing medical graduate, and even a nurse, a senior nurse, to be the leader of that particular center. And today we have a successful National Health Insurance Authority that was just signed into law by Mr. President. They have all the money to pay for citizens of Nigeria per month for health. If a medical practitioner that just graduated from the university after his youth service, you hand over to that gentleman or lady one primary health center, and you also hand over to that person 5,000 citizens. Health Insurance Authority, they have the money to pay for the 5,000 per unit, because they pay an average of 750 to 1,000 naira per person per month. So if that money, about 5 million naira per month, is given to that medical doctor or that senior nurse, that this is your primary health center, take care of it. We give you 5 million naira every month. When they go to London or they go to America, 5 million naira, they will not get that kind of self-employed revenue in London or in America. So if we do that, they will all come back home because they know immediately they finish their school, they are going to be a self-employed medical practitioner.
And in your assessment, 5 million naira is enough to take care of 5,000 people on a monthly basis?
5,000 people will not come to the hospital.
No, I understand that, but you budget for 5,000 people.
It's a volume business.
Yeah, but you budget for 5,000 people.
Yes, because I know 5,000, maybe 500 people will come in a month. They can't be sick. 5,000 people can't be sick in 1 month. It's not possible. So that's why it's called an insurance. So that money, that doctor in charge will be able to pay for electricity, will be able to pay for water, will be able to pay the nurse, and will be able to pay for the basic. And will also have some money to take home for himself as a medical doctor or as a leader of that particular center. Okay, in the United Kingdom, maybe they make maybe in 1 month, they can make up to £1,000 in terms of take home. I mean, most of the money they make in the UK, they pay for.
Well, are you talking about a nurse rather than a doctor?
I'm talking about a doctor that just graduated from university.
Well, they make more than 20,000.
Yes. Maybe they make about £20,000 a year.
Well, I think they make considerably more than that now.
Not as a new doctor. The ones that make that, they are better qualified.
No, I understand that. I mean, they have more experience, but as a starter. But anyway, let's not quibble about the UK, because that's not what we're here to talk about. We're here to talk about Nigeria. How much of a priority is, because I mean, what you're saying sounds quite interesting as a way of taking healthcare forward based on the limited resources that this country has, and based on the practical reality of what you talked about, which is brain drain. How much of a priority is the improvement of healthcare in this country to the APC presidential candidate Bola Ahmed Tinubu? As a medical doctor yourself, are you satisfied that he's giving it the attention it needs beyond the fact that you're a member of the APC? I mean, you have a responsibility as a medical doctor to be totally honest about these things.
Yeah, I will be very honest about that. I'm always very happy when people talk about the health of Asiwaju.
Now, I'm not talking about his health yet,
I'm telling
but
you
I will get to it. Right, okay. Okay, you want to deal with that?
I want to deal with that because it will now answer your question.
Right.
Because it was when he had the challenge of revenue in Lagos State, when he could not get what was to come to Lagos at the time was to come, that he now went out of the box to create the revenue generation of about 600 million or 700 million now to today now 51 billion a month. It was because he had that challenge. So I'm sure now that his own health is now on the front burner, I'm sure he will want to ensure that the health sector takes a very, very major priority in the new government when it comes in.
Well, let's talk about this health that you're talking about, his health,
Yes.
that you say is on the front burner. Lots of speculation there about whether he's going to keel over. Is he?
Well, you know, when I've been listening to different comments on his health, and I now look back at this democracy that we say we have adopted. The democracy that we've adopted is from the United States, and of course Europe and so on. And I looked at the history of the presidents of the United States concerning their health when they came in and during their tenure. And I realized that the most successful presidents had health challenges.
Were the most infirm. Is that what you're trying to suggest?
No, successful in terms of their, for example, I mean, I wrote it down here. Someone like James Madison in 1751 had epilepsy.
Yeah, but James Madison lived a heck of a long time ago, and at the infancy of America's democracy, at a time when healthcare was very, very underdeveloped. I mean, talk about the modern ones. Talk about the Kennedys, the Clintons, the George W. Bushes, the George H. Bushes. I mean,
someone like Clinton had hearing impairment.
Well,
when he was there. So what I'm trying to say is, health challenge of the individual.
So
unless his mental situation is at fault, that he cannot sit down in a meeting with his cabinet and have a contribution to make or have a direction to give them, then we can be worried.
Well, that's the point, isn't it? Because we don't know if his mental capacity is sound. I mean, there have been a lot of, faux pas and all kinds of things that he's been quoted or misquoted, however you want to look at it.
Well, I'm talking about my own personal experience.
Which raises questions, and I'm not saying that ineluctably he has mental challenges, but I'm saying that questions have been raised about that. Can you, because you brought up the issue of his health, you said now that his health is on the front burner. What do you mean by that?
What I mean is, the way they are going on about health is personal health. It's as if he's the one that went around collecting taxes himself personally when he achieved the success in the tax revenue generation of Lagos State when he was a governor. He was not the one that was going around and doing all the work. So, but he gave the policy direction. So, same thing when he becomes the president of this country. I've spoken with him, and I see he has the capacity to direct and to put information together and give you superior. If the knowledge is inferior, he accepts and he adopts what is superior. So I believe he has the mental capacity to govern this country.
Right. Okay, well, talking about what he's going to do about health, tell us about the symposium that you held today in Abuja, which focuses on repositioning Nigeria's healthcare sector and on creating a pathway to an effective health system in this country.
Well, definitely we know that by God's grace, the next government will be an APC government. So we don't want to wait until when we are swearing in Mr. President before we start planning how we want to rule the country or govern the country. So the health sector is very important because in all sectors of Nigeria, health is involved. The army, we need their health to be perfect. The agriculture, the farmers, we need their health. We need the health of everybody. In education, we need the health of them, the students. So health is a major aspect of a government. So we want to make sure that we don't get it wrong. And we start moving the first day of swearing Mr. President. So we have so many policies on ground. Okay, I was in the Senate up till 2019. When I got into the Senate, I made up my mind that I don't want to go after policies, new policies, because there were so many policies that we inherited from the previous government that were never implemented. So we just make laws and we don't implement them. So I decided to choose the low-hanging fruit at that time, which was the Basic Healthcare Provision Fund, that will ensure that funding of our primary health centers is achieved. And to God be the glory, we achieved that during my tenure in the Senate. Basic Healthcare Provision Fund, where we make sure that money gets to the primary health centers.
Out of those 30,000, how many did you revamp?
Well,
or
I wasn't in
strengthen?
the executive, I was in the Senate.
Yeah, but you're obviously, you have oversight functions.
Yeah, we have oversight functions,
Yeah.
but I mean, the minister will tell me that this health center that they built, they were not carried along, and they don't have the capacity. They don't have enough
well,
personnel.
I'm wondering how the difference you actually made in that regard. I mean,
Well, the difference made was to talk to my colleagues that we should stop building, because when you are campaigning for election, you tell your people that when I get there, I will build you one clinic or one hospital. It's a political, proposal to the electorate when you are campaigning, and it's common all over the country. That's why everyone tries to fulfill his promise by building. But what they don't understand is, because I'm a medical doctor, I know that the infrastructure is not what makes the hospital. We need the personnel, we need the doctor, we need the nurse. So if you don't carry the Ministry of Health along to say, I'm building a clinic in this location, do you have personnel to give me? Then you are wasting your time and money.
yeah, that's a good point.
So that is what has been happening.
Right. Now, a number of studies by medical groups like BioVentures, who deal with cancer and all the rest of it, and the WHO, have shown that Nigeria has been losing economically $5 billion annually because of the lack of cancer care alone. So there is data to show that Nigeria's economy would improve tremendously if it improved basic access to medical technologies and access. Your party, the APC, has been in power for nearly 8 years. Why hasn't it improved healthcare significantly? In fact, it has got worse because we haven't made the SDGs or the MDGs. And if you look at all the ratings of Nigeria's healthcare, the World Health Organization, Nigeria is at the bottom of the list, or close to the bottom of the list, in spite of the fact that your party has been there for the last 8 years.
It's just like you going for a buffet. There are so many things to eat. Well, you can't eat everything at the same time.
So which ones did you eat?
So let me tell you, in Nigeria, let me talk about Nigeria now, not the world generally.
Yeah, obviously we're talking about
Malaria is
Nigeria.
more dangerous to us than COVID. Malaria is more dangerous to Nigerians than cancer.
No, I
But it
know.
kills
I
more
just
people.
used that example.
No, I'm not telling you.
To say that just one area, because cancer has been getting worse in this country. And in fact, the latest statistics show that the death rate from cancer has exceeded the death rate from malaria. Because we've managed to contain malaria, although people are still suffering from it, but the death rate from cancer has become a bigger threat to this country. So the question is, just cancer alone, I didn't say everything, cancer alone, the losses from cancer are leading to this country economically losing up to $5 billion.
Okay.
And what I'm asking you is, given those statistics, what has the APC done with regard to healthcare in general, not particular to cancer, over the last 8 years?
Well, maybe because you have chosen cancer, I will also choose cancer.
Yeah, you can certainly talk about it.
One of the major casualties in cancer for women is cervical cancer.
Yes.
Every day, we have 28 women, according to statistics, dying of cancer daily in Nigeria. Okay? So, cancer has no cure. So the only way out is prevention. So what you should ask is, what is the prevention procedure of the country?
Yeah, and
Now, Nigeria, there's a vaccine against cervical cancer. Nigeria this year has confirmed that from, I think, the last quarter of this year, they will start giving the vaccination to children, females in that age range, all the children in the country, they will have capacity, or they will have the opportunity to be vaccinated against cervical cancer in all, just like you have it in the, like you did for polio, you're going to have it for cervical cancer now. That's a prevention that definitely, that is what the government can do. Because once it gets to the stage of curing, which is very expensive, and at the end of the day, the curing is not assured. But prevention is what the country is focusing on now. And I can give you that information.
Sure. I just used that cancer as an example because of the statistics and the economic impact that it's having in this country. You've also got things like infant mortality. As I said, the MDGs, the SDGs, we haven't made any of those. But given these alarming health statistics, as a medical doctor yourself, what message would you send out to all the political parties and to whoever wins in 2023? Because obviously there's no guarantee that it'll be the APC.
Well, the message I will give to whoever is in charge in 2023 May is that it should focus on primary health care. Because if you want to do everything at the same time, you will not get to where you're going. If you can get the primary health care functional properly, and we make the primary health care attractive to the health workers to come and work. Because we should do a model of a primary health center that takes care of the accommodation of the nurse, accommodation of the doctor, if we're going to have a doctor there, okay? And we make sure that the doctor has no problem. Then there must be a school close by for his children. So that primary health care center, the health center would, that doctor will take it very serious. And at the same time, the government should be in charge of quality monitoring. So they should have a kind of care quality commission that will just be ensuring that what that doctor and nurse in charge, because it's all about leadership. What they are doing, somebody must monitor it regularly.
Absolutely.
That is what the federal ministry or the government is for.
So somebody's got to be on top of them.
Yeah, on top of them to make sure once they lose that place, they give it to another doctor.
Okay. Well, let me get you to put on your other hat as the Pro-Chancellor of the University of Lagos, and therefore a leading figure in higher education in this country. As you know, Nigeria's university lecturers went on strike in 2022 from February to October for 8 months, virtually crippling the higher education system and destroying the lives of so many students. And it all happened under an APC government, and not for the first time. How did you cope with that strike as Pro-Chancellor of the University of Lagos?
Well, I mean, of course, I mean, I was not the happiest that most of the year the students were not able to have the education they paid for, even though the payment is not comparable to the private sector, but at least they paid something for it. We need the new government coming must ensure that, first of all, they don't see universities as a profit center. But as of today, the government expects the university to remit some of the income back to the national purse. We have to stop that, because the money they are getting is not even enough to run the institution. What the students are paying are the government institutions, the universities, what they are paying cannot run the institution. Then out of that, you want to collect about 25% again as your remittance to government. You first of all have to stop that.
Yeah, but how is it that the APC government allowed it to go on for so long, the strike? I mean, given the impact of that on the delayed degrees of so many students who had, their time in school dramatically and detrimentally extended.
Well, it's just like, unfortunately, I want to use the example of subsidy for petroleum. When they tell you the cost of petrol is this amount, that you must pay it. Then when you look at your purse and you see that you cannot afford it, there's nothing you can do.
Yeah, but you're saying there's nothing you can do. You're throwing your arms up, but you're the government responsible for finding ways to know what you can do. I mean, what about alternative forms of funding? What about all kinds of ideas, which is why people say we're going to give responsibility to you. We're going to give charge to you for taking care of things like that.
Yeah, well, you have to see this. We're talking about government now, and I'm a representative of the party. And I will say the government is taking care of education, defense, so many other institutions in the country. So by the time education asks for this, defense asks for this, and so agriculture, and so on like that. So I guess the government, in their wisdom, they're trying to make sure they satisfy every department of government.
And therefore failing in every department, because they've had problems with defense, they've got problems with healthcare, they've got huge problems with education.
Well, I mean, if they choose to say, oh, okay, let us just focus on health, let's forget all other departments, I'm sure it will still be a problem if they don't satisfy the other aspects.
Yeah, but in those circumstances where you have, if you like, de facto admitted that you failed in several areas, why should Nigerian people vote the APC back into office?
Because of my own understanding of how government works now. What I'm saying today is what we want to do, we wish we could do. But it's the person on the driver's seat that will know whether we have the capacity when you get there, that can we afford it. So we know the right things to do. But the issue is, do we have the capacity in terms of, as a country, got the capacity, the financial capacity to do it?
Okay.
So we can just ask, anybody can ask for the moon, but can you get there? Just like that?
Well, it's a very interesting question, and I'll leave that as a rhetorical question for the audience to form their opinions based on that question that you yourself posed. Senator Dr. Olanrewaju Tejuoso, who was the chairman of the Senate Committee on Health, currently Pro-Chancellor of the University of Lagos, and of course a leading member of the APC. Thank you very much indeed.
Thank you very much for having me.
Well, that's it for this edition of Arise Prime Time. Join us again next week. From me and the entire team here in Abuja and Lagos, bye-bye and thank you for watching.